Dear Medicos, we are having the honor to have Dr. Shah rank 24 NEET examination. So, beta, first of all, congrats for this achievement.
Thank you so much, sir.
So, beta, we will be using this platform to motivate all the juniors. I just want to share that what was a strategy, like how you proceed, like you are a 3-year student. So, in the last 3 years, what was your strategy which lead to this rank 24, 2-digit rank, beta, a awesome achievement. So let us use this platform. All the juniors listening to us, beta, please focus on each and every golden word and try to follow his footsteps so that we can get the success in the upcoming examination. Yes, beta, let us start. You join us in the 3rd year. What was the experience in the 3rd year?
Yes, sir. So I joined during the first at Ahmedabad offline center only. So during first, my target was to complete first, second, and 3rd year notes, so that during my internship I have plenty of time to read and revise them. And during my final year, that was the COVID year, so offline classes couldn't be conducted, but DAMS made sure that we were provided the best of the resources with the help of eMedicoz. So during my final year, I made sure that I had all the notes of final year subjects as well. So during these 2 years, my only goal was to have the notes ready with me, so that during my internship, I don't have to make them once again, and I can focus on a more number of revisions. And during my internship year, what I did was I joined TND session, and during that, my goal was that TNDs used to be conducted on Monday and Tuesday in our center at Ahmedabad. So my goal was during Wednesday to Sunday, I have to complete the subject whose TND is to be conducted on Tuesday, their entire notes plus MCQs, preferably previous year questions first, and then if the time permits, I will do other MCQs as well. But usually I was able to do the MCQs. So then when the day of test comes, I am well prepared with that subject. And then I used to give the test and attend the session as well. So that way I would have completed entire subject in a week, or sometimes 2 weeks for longer subjects. And DAMS had structured the TND classes very well, like for subjects like biochemistry and microbiology, it was divided into 2 sessions. Like in micro, we had one session on bacteriology, general and virology, another on parasite and mycology. So I divided my preparation in the same way, so that my first reading was with the help of test and discussions only.
So, but like you attended our face-to-face session in NEETS Ahmedabad, followed by in the final year, you made your notes of the final year subjects on the online eMedicoz platform. But what was the difference? Like in the final year when the COVID, you were at home. How was the experience of those live lectures on eMedicoz?
Sir, it was definitely great. The teachers were very much helpful in interacting with the students, which provided, a sense of connect with the teachers. And when you are focusing with that level of connect with the teachers in class, you remember more things as opposed to recorded lectures. So that was definitely a great experience. And
you attended in the class.
Every talk before me.
You attended in the classroom like DAMS Ahmedabad face-to-face lectures. How was that experience of classroom learning better?
Yes, sir. Actually, some of my colleagues, they used to find difficult for sitting 10 to 12 hours in a stretch. But I used to find it very much, easygoing, because the classes were so much, I'm not finding the correct word, so I will use entertaining. Means you never feel bored in the class. You always get to learn something new, and at the same time enjoy that process of learning. So it was a great experience, I would say.
So when like teacher were teaching in the classroom in front of you, standing and sharing all the experience and all the clinical knowledge in the examination hall, beta kahin aapko aisa laga, that point we have written in the classroom, that thing which we have written on the top. Any experience you want to share, beta?
Yes, sir, definitely. Many of the images shared in the class by the faculties are the exact same images which are asked in MCQs. So at that time, unconsciously you connect it directly to that image. So it helps definitely, and it saves a lot of time because many of my colleagues found it difficult to complete the paper in time, but I did not have any such problem.
So, but like you were saying, the many students, many friend of yours, they were not able to complete the paper on time. Time management before the exam, in the exam, these two were the most common causes. What we feel after discussing with most of the students who couldn't crack the NEET examination, if we were not comfortable with the time management before the exam, like we couldn't complete the whole subject. And in the examination, time management was the important, the key point for the getting success. So, beta, what was the rule of sitting there for 5-6 hours? That role, क्या उस 5-6 hours ने बेटा examination hall में आपको help किया? Yes, it कि हाँ, we can sit for 3.5 and we have to complete the whole topic. I am asking the role of discipline in the success journey.
Yes, sir. Discipline is definitely important, and I would like to point out here that CBT was equally important for this purpose because CBT conducted by DAMS have been excellent. Even some of I didn't get the same center, but some of my friends got the same center which were used by DAMS during CBT exams. So they had one extra advantage of reducing that exam center anxiety during the day of exam, and the paper pattern of CBT was almost equal to this year's NEET. Like the balance between factual questions and clinical questions, the length of questions, and the difficulty level, even I would say.
Like, beta, you are saying in the third year and the final year, you have written your notes, beta. So what was the role of those self-written notes like in the examination hall?
Yes, sir. Self-written notes are definitely better because it is something personal to you. You have made it, and so you know कि जब आपने बनाया था तब आपने ये चीज कहाँ लिखी थी, and you keep on revising it so that that page becomes like a photograph in your mind. So during the time of exam, when the question comes, subconsciously your brain connects it to that page, and you remember the answer in a fast manner as compared to other students, and that gives you an edge definitely.
So, beta, जब आप you are writing your self-written notes, you are having your notes with you. So, beta, like every topper is saying that we have to revise 3 to 4 times. So, beta, अगर आपने notes खुद लिखे हैं, self-written notes हैं, तो was it easy for you to do multiple revision after writing your own notes, beta?
Yes, sir. Yes, sir. Definitely.
Now, beta, coming on the final year, like in the internship, you join our T&D, you go for the test and discussion. Quality of MCQs, like all the faculties using in the T&D against the quality of INICET and NEET examination.
Sir, INICET I won't be able to comment because I didn't give the INICET exam. My only goal was NEET this year. So, but NEET definitely, I would say T&D questions were a bit tough than NEET, but they were ultimately useful only because the paper of T&D is made by the teachers in such a way that they cover almost every important topic. So after T&D, I would know कि इस subject में ये topics तो पढ़ के ही जाने हैं, so that you don't miss out important topics, running behind some topics which are not asked frequently and are not that much important as compared to T&D.
Coming on the importance of like basic sciences, like the pattern we are moving from NEET examination to the next more clinical oriented MCQ. So what is the role of basic sciences in this success journey? We are proud to have Dr. Jay with us, rank 24. And I feel better like you are getting this double digit rank in the very first attempt. So your success journey will be a motivation for
yes,
all the interns listening to you. So beta, what is the role of basic sciences in the new changing pattern?
Yes, sir. Basic science are definitely important, and they are changing the way basic science questions are asked. Like few years back, anatomy questions were like what is the attachment of this muscle or nerve supply. But now they would ask, okay, the person is not able to perform such action. So what would be the nerve that will be affected? So such types of questions are definitely present in our TNDs, and that helped us to know how to read the basic science subjects, because मतलब क्या पढ़ना है वो ज्यादा important है. You should know what to read in those basic science subjects, and even physiology, medicine, patho, these three subjects were definitely much more integrated in DAMS notes, so that helped very much. Like I remember medicine and surgery, all the faculties that used to teach, they used to first start with the basic physiology in medicine and basic anatomy in surgery. So that would help us, revise our mind towards the basic subjects first, and then build use it as a building block for the main core clinics.
So, but like on the weekend when you were coming to the DAMS Ahmedabad, like say any subject, ophthalmology, ENT, and you were completing the whole subject in the 3 days, what feel you were having on the Monday morning? Yeah, I have done my whole subject. Was it a step for multiple revision, beta?
Sir, sometimes I was not able to complete the entire subject, but I was confident enough कि जो important करना था इस subject में वो मैंने एक बार कर लिया है. So I knew कि ये subject अब मैं revision थोड़े 1-2 महीने बाद होगा तो भी चलेगा. Means I would get that much confidence कि subjects सारे खत्म होते जा रहे हैं, so that I would have time for revision. Means it is better to have a structured plan than going blindly into it.
Now coming on the prof exam, beta, like you were preparing for the NEET examination, you were attending all the classes, the role of DAMS class notes in your prof examination.
Sir, I would say medicine notes for DAMS are the best source for prof exam even. I would not discourage my juniors not to read Harrison's and other textbooks of medicine, but I would like to emphasize the importance of DAMS notes in it. Like medicine is a very vast subject, everyone knows. So in DAMS notes, we would know which topics we have to read and how much detail we have to read in those topics. Like infective endocarditis from cardiology is an important topic. So the DAMS notes would give us the basic outline of the topic and what are the important points in it. So I would first see that and then go on to Harrison and see what extra things are written in that. मतलब एक outline मिल जाती थी, फिर it would have become easy to read Harrison. So DAMS notes helped very much in medicine, because I was a little bit afraid of medicine when I came into final year, seeing the volume of Harrison. But after attending DAMS classes and then seeing Harrison, it was very much easy. And now I have fallen so much in love with medicine that I have decided to take up it as my PG seat as well.
That's great, but and we are confident the way you are giving very honest feedback, you are sharing all the basic small tips to all the juniors. You are the honest people. I feel honest people always excel, and we are confident in the upcoming years you will do excellent job in your whatever branch you are going to join, beta, and we are confident and we wish you very best of luck. And
Thank you, sir.
We're proud to have Dr. Jeff with us, rank 24 in the NEET examination. Now, but after learning, after attending all these sessions with DND, last 5 days of DVT, how was the experience of those integrated sessions and how they played the role in your success journey?
Sir, definitely those were important. Means I first attended the DVC sessions live, and then the exam was delayed. So I made sure that during my each subsequent revision, I would just see the DVT notes once. So during the last 10 days before the NEETPG exam, my goal was I would take the DVT notes and see which topic is taught by the faculty in that subject, and then I would read it from the DAMS notes. So during the last 10 days, I would know which topics are must to revise before the exam. Like this was the last 10-day strategy, and DVT helped it very much. मतलब उसके डीवीडी के कारण बहुत इजीली रिवीजन हो गया था लास्ट 10 days में.
Yes, beta. On the last page, beta, any special message for your family, followed by any special message for the DAMS family in your success journey?
Sir, words would be less to describe the role of DAMS in this success, because there are many such things which I feared, and I never expected such a good rank. But DAMS has given us such beautiful notes that and such great teachers who have helped throughout this journey. So thank you very much, sir.
Thanks, beta. Thanks, and we are confident all these juniors listening to you will take your golden words and they will follow in a very structured way. They will be writing their notes. They will be revising again and again. What I'm getting from your discussion, okay, yeah, we should write our notes. We should concentrate more on the basic sciences, and we should revise multiple from a single source. That's great, beta. Thanks, Dr. Jay, for coming on this platform, sharing your success journey, and on the behalf of DAMS family, we wish you very best of luck, beta. Thanks a lot.
Thank you so much. Thank you.